Talking about pharmacokinetics, and this is on page 259 of First Aid 2012. And the page looks like this. So if we were to plot over time a plasma concentration of a drug, you would get a characteristic curve like this. And we could say that the first part of the curve was F, or the bioavailability. That's the drug being absorbed into the body. This next part of the curve is the steep downslope, and that's going to be the volume of distribution part of the curve, where the drug is being distributed throughout the body. The last part of the curve is the clearance part of the curve, where the drug is being eliminated. So let's start with Cp, the plasma concentration. And if we take that, we know Cp, C is concentration, P is plasma, and that's just going to be equal to the mass of drug in the body divided by the liters of plasma in the body. Plasma is just the liquid part of the blood. That's the blood spun down and the cells removed. Red blood cells, white blood cells, platelets, etc. The serum is the plasma after you've removed fibrinogen, the protein fibrinogen, which is in the clotting cascade. So plasma and serum concentration of a drug are actually the same thing because they're both just the liquid part of the blood, but one of those has a protein removed from it. So that's the plasma concentration, or the serum concentration. The next part we're going to talk about is the bioavailability. That's the drug being absorbed into the body. So if you give a drug, there's two main categories of ways you can give it. The first one is parenteral, or IV. Para means beyond, past, or around, and entero means intestinal. So this means beyond or around the intestine. That is, you're not going through the intestine by taking a pill. You're going around it into the veins, intravenous. PO is the other way, which is per oral or by mouth. That's just taking a pill. So if you took 3 pills by mouth into your intestine, the intestine isn't perfect at absorbing things, so one of those pills just might not be absorbed. The other 2 pills can make it through the portal circulation into the liver, but the liver will break things down. It might break down one of those pills. That's called the first pass effect. That last pill will make it into circulation, and that can be compared to giving a drug intravenous, and you'd just be injecting 100% of that drug into circulation. So giving it by PO in this example, only 1/3 of the amount of drug that you gave, those 3 pills, only one of those pills actually made it into circulation. Whereas if you give a drug IV, 100% of the drug that you give immediately makes it to the plasma, into the circulation. So you can draw 2 curves, one for IV and one for PO. And if you were to integrate these 2 curves and get the area under the 2 curves, you can compare those and get a fraction by dividing the PO curve by the IV curve, and that fraction can be represented by F, which is unitless. So that's the bioavailability. That's a comparison of the amount of drug plasma concentration time of PO versus IV. The next part of the curve is the VD, the volume of distribution. So mass over volume, most people are familiar with that being equal to the concentration. And in the situation we've just described, we know mass, which is the mass of drug in the body. That's how much drug makes it into the body. And we know a concentration we just talked about, which was the plasma concentration. So the only variable that we need left here is volume, and we can just make it up because we have the other 2, and we'll say that's the volume of distribution, and rearrange the equation and define it, which is just mass of drug in the body divided by plasma concentration. So we've just defined this variable, the volume of distribution, with this equation. We actually haven't measured the volume of distribution, we've defined it with 2 other variables. So this is best explained by a 3-compartment model: blood, tissue, and fat. So if you were to give a drug, a pill in this situation, and it bound to albumin. Albumin is a plasma protein, which means that if the drug 100% binds to albumin, when the drug is dissolved, it'll only be in the blood, because albumin is only in the blood, and the albumin will bind all of the drug. So going back to our equation for volume of distribution, you know how much mass was given, and you can measure the plasma concentration, and you'll get a volume of distribution, which is just going to be the total blood volume. So all you've done here is you've given a mass of drug, and measured the plasma concentration, and what pops out is the volume of blood, usually 5 to 6 liters. That just is going to tell you that the drug is bound to a plasma protein like albumin. So how about the drug looks like this, which is a very hydrophilic molecule, and if it looks like that, it'll dissolve wherever there's water, so into the tissues in the blood. Going back to our equation here, if hypothetically the tissue concentration and the blood concentration are the same, the volume of distribution is just going to be the total body water volume. So all we've done here is we've taken some massive drug and put it into some volume and measured the volume by measuring the plasma concentration in the mass of drug. So in this situation, the volume of distribution is exactly where the drug has been distributed to, which is the tissues in the blood, the total body water volume. The last situation is if the drug looks like this, which is a very hydrophobic drug, and that's going to dissolve in the fat, in the lipids. So going back to our equation here, you might be tempted to say, based on the last two situations, that the volume of distribution is going to be the total fat volume of the body. But that won't be the case. This is because the plasma concentration is what's used in this equation. We're not using the fat concentration, we're using the plasma concentration, which is exceedingly low because the drug is distributed only to fat. And if that's the case, and we look at this equation up here, if the denominator gets really small, the volume of distribution is going to get really big, possibly even bigger than the body volume. So if you get a volume of distribution, say 1,000 liters, there's no human that's 1,000 liters. That's not telling you that the drug is distributed over 1,000 liters. It's telling you that the drug is confined to fat, and when you measure the plasma concentration, it's pretty much nil. So that was volume of distribution. And the last part of the curve we want to talk about is the clearance. That's the drug being eliminated from the body. But before we can talk about clearance, we need to talk about the rate of elimination, which is different but related. The rate of elimination of a drug is the amount of drug change over time, or the amount of plasma concentration change over time for that drug. So that's the amount of drug being removed over time. For a zeroth order elimination, what that's really saying is that you can make an equation where the rate of elimination is some constant times the plasma concentration to the zeroth power. And anything to the zeroth power is just 1, which is the constant here. So the reason it's called zeroth order is because you've taken the plasma concentration to the zeroth power. And if you draw a graph like this for zeroth order elimination, it's a straight line. So the slope of the line is the change in concentration over the change in time. That's the rate of elimination, change in concentration over the change in time. And what we see here is that the slope of this line is constant. That is, the rate of elimination is the slope, which is constant. So a zeroth order elimination will have a straight line for the plasma concentration compared to time. The next situation is a first order elimination. This is much more common. What this is saying is that the rate of elimination is the constant times the plasma concentration to the first power. That's why it's a first order elimination. And the curve for this will look different. It'll look like this, a curve. And what that's telling you is if you take the slope at the beginning and the slope later on, the slopes are different. And we've already said that the slopes are the rate of elimination. So what we've said here is that the rate of elimination early on is very high. It's a very steep curve at the beginning. But over time, the rate of elimination is lower. That is, the rate of elimination depends on the plasma concentration. And as plasma concentration decreases, so does the slope, which is the rate of elimination. So now we can define a half-life like this. For a first order elimination, let's take the plasma concentration at time 0. And the question is, how long does it take to get to half that plasma concentration? Well, it'll take that amount of time. So how much time will it take to get to half of that concentration? It'll take that amount of time. And the time to get to half of that concentration, that time. And the unique thing we see here is that all of those lengths, all of those times, are the same length. That is, you have a constant half-life for a first order elimination. And we can make an equation for this, which is going to be the natural log of 2 times the volume distribution over the clearance. And that makes sense because what you can really do is say volume of distribution increases, that is, the drug is distributed over more volume. Well, it's going to be more difficult to eliminate drug that's distributed over more volume, so the half-life is going to be longer. If the clearance increases, that means the drug is being cleared faster, which means that the half-life will decrease. And that makes sense when you look at these two numerator and denominators. So that's the half-life. Now, can we calculate a half-life for a 0th order elimination, which is represented by this straight curve? Well, if you take the plasma concentration at time 0 and you ask how much time does it take to get to half of that concentration, it's that amount of time. Half of that concentration, that amount of time. And what you notice is that the half-life are not all equal. That is, they're not the same half-life. So we don't have some equation for the half-life for a 0th order elimination because it can't really apply. It depends on the plasma concentration. So now we want to talk about clearance, which is related but different than rate of elimination. Clearance is the volume of plasma from which the drug is completely cleared. So hypothetically, if we have some volume of plasma that's represented by this cube right here, and you take some amount of that volume and you make it completely clear, that is, you've removed all of the drug from that plasma. That amount of blood that you've just cleared, how much time it took to do that, that's the clearance, the volume of plasma divided by the time it took. But it doesn't stay clear if you eliminate some drug from some part of the plasma. It'll equilibrate. And you can do that again. You can take that same volume, clear it, and let it equilibrate. And if you do this again and again, over time, the drug is eliminated. And that's what the liver and the kidneys are doing when they eliminate a drug from the body. Some amount of blood makes it to the liver or the kidneys, and the drug is cleared from that volume that makes it to the liver or kidneys, and then it's mixed back in with the volume of plasma. And over time, it's completely cleared. So this is in contrast to the rate of elimination where it was the amount of drug over time. This is the amount of plasma over time. That's volume over time. So that's the curve. Now the question is, how can we make sure we get to the right plasma concentration? You know the plasma concentration that you want from animal studies or experience, and that might be really important because some drugs have a very narrow therapeutic window, which means that if you give too much drug, it can have a very toxic effect, and if you don't give enough drug, the drug won't have enough of an effect. So how do you make sure you get to the right plasma concentration? Well, you know the desired plasma concentration, which the units are mass over volume, and how much dose should we give immediately? That's going to be called a loading dose because you're going to be loading it into the body, and that's going to be some amount of drug you immediately inject or give by mouth. So we know mass over volume, and we know mass. How do we convert mass over volume to mass? You can multiply it by volume, and the volume we know about here is the volume of distribution. And there's one other thing we have to take into account, which is the bioavailability, and that doesn't mess up our units because it's fractionless. So that's the loading dose. That's how much drug you give immediately. Now, how do we make sure we keep the drug at the right plasma concentration? That is, the drug is going to be distributed and eliminated from the body, so how do we make sure that the plasma concentration stays in the therapeutic window over time? So you know a desired plasma concentration. And how much dose should we continue to give over time? That's amount of dose over time. That's going to be called the maintenance dose. So the question is, how do you convert a mass over volume to a mass over time? Well, you'd multiply it by volume over time. And what unit has volume over time? That's the clearance. But again, we have to take into account bioavailability. The units all work out, and we have our maintenance dose. That's how much drug you continue to give over time. So hypothetically, if you have a desired plasma concentration and you give a loading dose, that'll get you 100% of the way to the desired plasma concentration. Now, if you were to wait one half-life, the amount of drug left in the body would be 50% after one half-life. If you were to give another loading dose, you would get 100% in addition to that 50%, and you'd be up to 150. If you waited another half-life, you'd eliminate half of that drug, and you'd be down to 75%. If you were to give another loading dose, you'd be up to 175, and if you waited another half-life, you'd be at 87.5%. If you kept doing this over and over time, eventually you'd get to 200%, and after a half-life, you'd be at the desired plasma concentration. Now, this is not the way they normally give drugs. They don't give a loading dose and then wait a half-life and give another loading dose. The way they normally do it is they start off on a maintenance dose. That is, they start an IV drip, and they just do a constant infusion. And the drug will slowly make it to the desired plasma concentration over time. The reason why I gave the illustrative example on the left here is the math actually ends up being the same. What I mean to say is if you just start someone out on a constant infusion of the maintenance dose, it'll take 3 half-lives of that drug to get to 87.5%. The takeaway point is that it takes 4 half-lives to get to at least 90% of the desired plasma concentration. But the best way to do it would be to give a loading dose and then a maintenance dose, because that would give you immediately up to the desired plasma concentration, and it would keep you on that plasma concentration.